I'm so excited to be here for our first NAMIGO Talks of 2023, and very proud to be partnering with the Mental Health Association of Central Florida. Sierra came into our office a couple weeks ago and told us about the Guardian Advocate certification training. And we were so excited about bringing this opportunity to you all because just like you all mentioned in the chat, you're here to help others. You're here to work towards this cause. And this program is one that will directly impact individuals. And Sierra is going to tell us all about that. See who else we've got in here. We've got Bruce Turner. Wonderful. Great to meet you all. Hi, Rick. Hi, Mary Lynn. Oh, wonderful. Okay, well, if you all have any questions for me or Sierra throughout this process, you know how to use the chat. Thank you so much for engaging with us. We will have questions at the end. So if you have anything that's like really you've got to get Sierra's opinion on, please write it down. We will make time at the end to answer any questions you all have so that you can get involved with this program. But before we kick things off, I wanted to introduce myself. My name is Megan Weeks. I live in Orange County and I work with NAMI. I am NAMI's new programs director in the greater Orlando area. So I get to work with Orange, Seminole, and Osceola counties. So I'm really excited to start off the new year with Sierra and the good work that they're doing over with Mental Health Association. And I just want to thank you all so much for being here, being part of this grassroots movement, and continuing to show up for our communities. So with that being said, I'm honored to introduce you all to Sierra. She's going to tell us all about this incredible program that is impacting people's daily lives and helping them to live the lives that they want to live. So please, a little round of applause before we go on our mutes and get our listening ears going. Thank you so much, Sierra. I'll pass it over to you.
Yes, thank you. And good evening, everyone. My name is Sierra Ross. I am the Guardian Advocate Program Manager at the Mental Health Association of Central Florida. I've been with the association now for about 9 months, so I'm still learning along the way, but I definitely am enjoying working within this program, sharing more information about the program, facilitating the training, and I'm here to answer any questions that you all may have. So we're going to just get into some of the basics about the Guardian Advocacy Program. We're not going to go too deep into the training. I hope by the end you all would be interested in finding out more information about the training. Yeah. And I'm in Orange County, so wanted to share that as well. All right, so just a little bit about the Mental Health Association. It was established in 1946. It was originally called the Mental Health Association, a Mental Health Hygiene Association, and over time, the name did change. So the Mental Health Association is the leading community-based nonprofit in Central Florida dedicated to addressing the needs of those living with mental illness and promoting the overall mental health for all. We do this by the programs that we have. So one of the programs that we have is called Connections. Another program is Outlook Clinic, which is in partnership with Advent Health, our Reflections program, and the Guardian Advocacy program. Here we also have our equity statement. The Mental Health Association of Central Florida understands that violence, racism, hate, and discrimination undermine mental wellness and are significant contributors to individual and community trauma. So we definitely try to focus on making sure everyone that needs mental health assistance receives that through all of our programs, which are all free of charge. So our Connections Referral Program is a free mental health information and referral service program. So we mainly have interns that assist with submitting referrals in Orange, Osceola, Seminole, Lake and Brevard, and Volusia County. So we have over 1,700 providers within our system, so anyone can call in or fill out a referral form online. And if you need some more information about that, I have a contact for our program coordinator, or you can refer to our website at MHACF.org. Another program that I mentioned is our Outlook Clinic. Again, that's in partnership with Advent Health. So our Outlook Clinic provides direct psychiatric care for the uninsured. So anyone that has a diagnosis of depression or anxiety can go to our Outlook Clinic and they can receive direct care from a therapist. And they also provide medication management as well. So anyone can fill out a referral online as well through our Connections program, or you can call the clinic to get more information. Reflections Peer Recovery is a peer reflections group. They meet online now during the pandemic. A lot of the sessions were virtual. There are some sessions that hopefully in the near future will begin to be in person, but all of the peer groups right now include grief support, sexual trauma support, suicide support, and QPR suicide prevention training. Next is Coping Together. So Coping Together is a web series that was originally launched during the COVID-19 pandemic. So we have continued on with that series, and we have a couple of videos on our website now. It's mainly just conversations with other mental health professionals in the community or others just having conversation about different mental health topics. You Are a Lifeguard is a new initiative that we started about a year or two ago. So it's building a movement to prevent teen suicide. So over the years, teen suicide, unfortunately, the numbers have unfortunately increased. So we have a lot of promotion as social media to bring awareness to the community about assisting adolescents with suicide prevention. So if you are interested, you can take the pledge at yourlifeguard.org. So the state of mental health. So if you're not familiar with Mental Health America, they actually release a report yearly on the state of mental health. So this is just a snippet of what the report is. It's pretty lengthy. They have a specific criteria that they utilize to break down what was the most prevalent mental health illness in the country, what resources, what state has the most resources, what states don't have the most resources. So this might be a little small, but definitely the report is accessible online. So if you can see from here on this report, they're just notating the prevalence of mental health in the year of, I believe this is 2019 to 2020. So this report is for this year, but this data was taken in 2019 to 2020. So from the findings of this data, 20.78% of adults experience mental illness, equivalent to over 50 million Americans. So on this rank for the individuals that the states that have the highest prevalence of mental health, it's from 39 to 51. So 39 is Wyoming and 51 is Utah. I know you see Florida here as number 1, but it was actually ranked a little bit lower than a couple other states. Still, there is definitely a need for more mental health awareness, which is why we do these talks and also why we provide the guardian advocacy training. All right, so we're going to get into what is the Baker Act. So the Florida Mental Health Act, aka the Baker Act, is a Florida statute. So it is a Florida law that was created in 1971 as a response to national advocacy for patients' informed consent. So at the time, former State Representative Maxine Baker and Beth Johnson proposed this bill to assist individuals who were involuntarily placed in mental health institutions at the time. That's what they were called. Now we refer to them as Baker Act receiving facilities. The acronym that we typically use at the Mental Health Association is BARF, because it's a little bit shorter. But the purpose of the Baker Act is to allow time for a mental health evaluation to be performed and to de-escalate a crisis. The evaluation confirms whether the individual is experiencing a mental health issue, and if the person is determined not to be a danger to themselves or others, they will be released after a holding period. The Act restored rights to many individuals with mental health issues by releasing those that were not a danger to themselves or others. So this is the Baker Act in Florida. So the University of South Florida, they collect a lot of data regarding the Baker Act. They also assist the Department of Children and Families with their Baker Act manual. So this is just a highlight report of the Baker Act as far as in Florida from 2020 to 2021. So you can see individuals that were involuntarily Baker Acted are 194,000 individuals in the state of Florida. So you don't necessarily have to be a resident of Florida for the Baker Act to apply to you. As long as you're in Florida, the Baker Act applies to you. So this is just a breakdown of by different demographics, individuals by profession. Also, this report is accessible online as well. I know it might be a little small, but I just wanted to give you all kind of a glimpse of how the Baker Act law is affecting a lot of individuals in the state of Florida. So how is a Baker Act initiated? So per the statute, a person that is involuntarily placed for treatment upon finding the court. So I do have a quick question for a lot of people that don't know, if you want to take just a wild guess. Since we're talking about the Florida statute and then there is some court involvement, if you were involuntarily Baker Acted or someone you know was involuntarily Baker Acted and they needed to attend court, where would court be held, if you had to guess? And when I say court, it's called mental health court. So where do you think mental health court is held in the state of Florida? Where would it be?
In the hospital?
Yes, that is correct. So if you're familiar with like mediation, things of that nature, that's very similar to what it is. There is a magistrate judge that handles all of the Baker Act court proceedings. There is a court reporter in the room, there's state's attorneys, and there's public defenders. So it's very, definitely very serious, of course, but it's held like you would attend court. So back to the Baker Act initiated. So they're looking at a specific criteria based on the statute, and they're considering does the person have a mental illness? And because of the mental illness, have they refused voluntary placement for treatment? Or are they unable to determine whether treatment and placement is necessary? So they're assessing if this individual can voluntarily place themselves in a Baker Act receiving facility, so in a BARF, or do they need someone to make that decision for them? If the person is incapable of surviving alone or refuses to care for themselves, such neglect poses a real or present threat to themselves, this is also something that can qualify for them to be Baker Acted. And they will also consider if all available less restrictive treatment alternatives, which would offer an opportunity for improvement for the person's condition, have been judged to be inappropriate. So if there's not a chance for them to receive any assistance, maybe from a family member, or maybe that assistance is just not what they need right now, they can go to a Baker Act receiving facility. So who can initiate the Baker Act process? So an individual can voluntarily admit themselves to a receiving facility. So for the Mental Health Association, we have a partnership with 6 facilities. So they can go to any facility and say that they would like to be admitted. They can go on their own. Or a licensed provider can complete a Baker Act form and request to have law enforcement transport an individual to a crisis center. Another way of initiating a Baker Act is a person in crisis, a community member or family member can call 911. So maybe someone in your community you may see is having a mental health crisis, and the best support that you want to provide with them is maybe calling for assistance. And a crisis intervention trained officer more than likely should be going out and performing that Baker Act. Or the court may enter an ex parte order stating that a person appears to meet the criteria for involuntary examination. So if someone is submitting an ex parte order, they do have to go through their local county court, and they would have to file that within 7 days. And then the court would have to either approve it or deny it, and then they would have law enforcement go out to wherever that designated person might be to see if a Baker Act needs to be initiated. Baker Act transport process. So as of 2022, a person who is being taken in for involuntary mental health examination can be transported by police. Initially, that actually wasn't the case. For the most part, law enforcement was the only individuals that were able to transport people to Baker Act receiving facilities. So because the Baker Act also applies to adolescents and children, that's one of the reasons for why that changed. In the state of Florida, children are more likely to be Baker Acted than adults. So if you can only imagine a child that is at school and they are experiencing a mental health crisis and the staff at the school seem fit that they need to initiate a Baker Act, hopefully a resource officer might be able to assist, but if not, then law enforcement would have to transport that child to a Baker Act receiving facility. So now that is no longer required. The police may take the person to the nearest receiving facility, or any person, as I mentioned, any person in the state of Florida is subject to the Baker Act. So there are 3 places that someone can go upon someone meeting the criteria for a Baker Act, and the process being the process actually starting. So they need to initiate that transport. So maybe someone has unfortunately initiated some self-harm and they may need more assistance. They can be transported to a local emergency room. They can be processed through law enforcement. The individuals that we provide guardian advocates to, in some situations, are involved in some other activities that may have landed them experiencing a mental health crisis, and they were actually transported to a local county jail, and then they received mental health treatment at a facility. Or they can go to the nearest receiving facility. The goal is to take someone to the nearest one, but it really depends upon bed availability. So not every facility has enough room to have everyone in it. They definitely want to make sure that they're not over capacity, but in the state of Florida, there are about 134 receiving facilities. So this is something else that's also accessible online. Again, this is the Baker Act manual. So I like to show this because this is basically how you can kind of see the flow of how a Baker Act can start. It all starts at either voluntary admission or involuntary examination. So voluntary, again, is someone voluntarily going on their own to a Baker Act receiving facility. You can see the flow chart is a little bit longer if someone is involuntarily placed. That's just the process that's going to be a little bit different. So they can be involuntarily placed into a facility. Within 72 hours, the facility has to complete an evaluation with them, but that doesn't include weekends or holidays. So an example I just gave during a training would be if someone went in on maybe they went out on Thanksgiving this year, which was on a Thursday. So that's not counting a day yet. And then the next day, if you're counting the day after Thanksgiving, that's not counting a day yet either. Saturday and Sunday. So they've been in a facility for about 4 days now. So that's not counting the 72 hours. So the 72 hours are weekdays only that don't include holidays and weekends. So sometimes when you think about that 72-hour hold, it can definitely be a little bit longer than that, depending on when that person entered the facility. So once they do enter, say someone does enter involuntarily, they complete that 72-hour hold, they are evaluated. A psychiatrist will make a determination if this individual is competent to consent to treatment. So they will explain to them what is happening. They'll explain to them what they can do as far as treating them, and they can ask them what they would want. So if someone's not able to provide that consent, they are involuntarily placed. They're not able to say, I want to be here. I want to receive the help that you're giving me. They need someone to provide that consent. So again, that's where the guardian advocacy falls into play. And again, I know it's a little small, but all of this information is accessible online. So that informed consent. So informed consent to medical treatment is fundamental in law, in both ethics and law. So patients have the right to receive information and ask questions about recommended treatment so they can make well-considered decisions about care. Successful communication in the patient-physician relationship fosters trust and supports shared decision-making. So when someone's not able to provide that informed consent, you can essentially say that they're being held against their will. I know within the statute, that phrase is often used because everyone that goes through the Baker Act process, they have rights. But not until 1971, when the Baker Act law was created, were those rights actually acknowledged. So when someone's not able to provide that consent, there's a concern. And no one knows if they're in that facility, if they were in there for that 72-hour hold, but they maybe went in on a weekend. So they're in there a little bit longer because unless that person provided a name or a contact number for someone at the facility, that's the only way that someone can call and confirm if someone is there. For HIPAA reasons, you can't call and just say, hey, I have a family member by this name, are they there? Facility, if they're going by HIPAA protocol, will not be able to confirm or deny that at all. So since we're on the topic of guardian, I just want to go over the different guardians in the state of Florida. So guardianship falls under Florida Statute Chapter 744, which applies to individuals 18 and older or aging out. So that's more along the lines of someone that is making medical, financial decisions for someone. So it's very different than the guardian advocacy. We typically kind of get phone calls about guardianship. So if you have a family member that needs further assistance beyond a guardian advocate, you might consider guardianship. And then guardian ad litem falls under Florida Chapter 39, applies to individuals under the age of 18. So a guardian ad litem is someone that can be a volunteer or an attorney, depending on the county, and they advocate for children who have been allegedly abused or neglected. So they advocate on their best interests in regards to reunification or maybe adoption or foster care. So the Guardian Advocate Certification Program was created by the Mental Health Association in 1997. So the Baker Act law, the mental health law, was created in 1971, but not until 1997 was the Guardian Advocacy Certification Program implemented. So there was a lot of individuals you can imagine from 1971 to 1997 that didn't have anyone to advocate for them. So typically when someone is Baker acted, they are involuntarily placed. The facility will give preference to the individual's family members, or maybe someone that's a close friend or next of kin. But in order to be a guardian advocate for someone, you definitely have to be present in the state of Florida to attend Baker Act Court, which is in the hospital and the facility. So sometimes some people are in a situation where maybe they do have someone that can be their guardian advocate, but they live in California and they're not able to get to court within the next couple of days. Or maybe there are some people that they don't have anyone that's willing to be their guardian advocate. There's no one that is willing to step up and advocate for them. We do receive requests from facilities where the facility has spoken with a family member multiple times and the family member has denied or has not accepted that opportunity to be that individual's guardian advocate. That happens as well. So all of our volunteers are assisting people that definitely need advocates because there's no one else that has been identified as an advocate for them. So the law actually continues to change at least every other year. So definitely during this legislative session, keep an eye out for any changes regarding the Guardian Advocacy Program. But in 1997, this was implemented because they needed to have a surrogate decision maker for individuals that were involuntarily placed. So the Guardian Advocate Certification Program includes an educational course that clearly explains what a mental health crisis in the state of Florida and how to access it and a patient's right during treatment. So it is a 4-hour course right now. We do the course on 2 days, so 2 hours one day and 2 hours the following day. There is a post-test to be certified. So all of the training material, everything that we explained during the training is approved by the Department of Children and Families. So they provide the post-test, and then that's how we can get individuals certified. Certification is required in order to be an advocate for an involuntary client. The certification does not expire, but it only applies to the state of Florida. The Mental Health Association is the only organization that provides a live interactive course. If you were interested more in a self-paced, kind of go on your own, the Florida Board of Certification, they have a course online as well. I'm not sure if there's a fee associated with it. I believe right now, I think there is, but you can definitely access their training online if you want to do more of a self-paced. So our Guardian Advocacy Program trains individuals to serve as temporary surrogate decision makers for involuntarily hospitalized clients under the Florida Baker Act who have no family members to act on their own. Again, the training that we provided is free and it qualifies for 4 CEUs, so continuing education. And when a community member is involuntarily hospitalized, this is often one of the most difficult times of their lives. So becoming a guardian advocate, you can be their guide and help them back to recovery in their time of need. The training is centered on patient rights and knowledge of the Baker Act so that the surrogate decision maker can act as a safety net to ensure the patient is treated properly and fairly while involuntarily hospitalized. So after the training, we do have a short interview process. And to officially become a guardian advocate, you do have to complete a level 2 background check with the Department of Children and Families. So if you were wondering, how may I become a guardian advocate, which is a wonderful question. So here's how. You can definitely contact me. You can email me. You can also reach out by phone for more information on how to register for training. All the training dates are also on our website at MHACF.org. After the training, there is a post-test. You are required to get a 15 out of 20 on the test to successfully complete the training. And then you would complete a level 2 background check that would make you eligible to be a volunteer. So there is no requirement to have experience or volunteering in mental health or social services to be an advocate. Benefits. So the ultimate benefit, of course, is advocating for someone and mental health awareness in your local community. You will also receive a $50 stipend for each guardian advocate court appointment. So there is an incentive. And then if you are able to refer someone that has successfully completed training and they've accepted at least 1 client, then you would be able to receive $50 for that referral. There is a limit to at least 10. And that's the Guardian Advocacy Program. Very quick, but do you all have any questions for me? So step 1, so after you complete the training, you complete the post-test, you have an interview with myself, you successfully pass the background check. And what we do everything electronically. So I get requests from our 6 partnered facilities. They can range from 30 to 50 requests a month. So we do get a lot of requests throughout the month from various facilities. So what I would do, I send it out to our volunteers. We allow them to see what requests are available because it really depends on their time commitment, because we get a heads up on what the facility is requesting as far as how long they foresee someone to be in the facility, aka how long they think someone's going to need a guardian advocate. So it can range from 2 to 6 months. So for some people, 2 weeks to 6 months. So for some people, 2 weeks is enough time. They definitely can dedicate about 2 weeks to that, or maybe they want to work with someone long-term. Typically, people that are going to be in a facility for up to 6 months are on a track to go to a state facility. So again, there's not that many state facilities, so the waiting period in a Baker Act receiving facility can be a little bit longer. So volunteers are able to see what requests are currently available based on the court dates. So typically we get 48 business hours to assign someone to an upcoming hearing. They get the request, they let me know what they're able to accept, and then I reach out to the facility, and let them know that this individual has accepted this request. They are the proposed guardian advocate. So not until you get to the facility will you have an opportunity to meet with the client. So you don't meet with the client beforehand. Typically, only public defenders will meet with a client beforehand because that's the person that they're representing. So they may want to just ask them some questions. Do they see fit that they should be in this facility? Do they want to be released? What do they want to see the outcome in this hearing? So when you go to the hearing and you go through the proceedings, then you're appointed as a guardian advocate. But the caveat to that is some petitions for involuntary placement are denied by magistrate judges. So the magistrate will make the final decision regarding the petition. So if they do deny the involuntary placement for petition, that means the person has to be immediately released, and then they no longer need a guardian advocate because they're getting released. So once you go to court, that's essentially kind of where you go next as far as being appointed, and then when you can talk to the client. Yes, in a sense, if the client attends the hearing, but they're not required to attend the hearing. Legally, if they tell someone at the facility that they want to attend their Baker Act hearing, they have to make sure the client attends. So I've seen sometimes where a client wasn't transported from the Orange County Jail to attend the hearing, but he said he wanted to attend it, so the hearing could not be held. Because by law, he has a right to attend if he said he wanted to, or whoever wants to attend.
Okay.
Yeah, and then after you are appointed officially as a guardian advocate, then each guardian advocate spends about 3 to 5 hours meeting with a client. Also, what you're appointed to will be what the magistrate will make a decision on. So there's different things that people can be appointed to as a surrogate decision maker. So you can make medical decisions, you can make medication decisions, or you could do anything else that's appointed. Typically, it's one of the two. It does apply to all of Florida, but in Orange, Osceola, and Seminole, typically those are the counties that ask for volunteer guardian advocates. So not every county in the state of Florida has a volunteer advocacy program. They kind of do it very differently. You'll be kind of surprised, like maybe in St. Pete, they might have one designated person at a facility that's a guardian advocate for everyone that needs one. I'm not sure about Brevard, but they might have that same process. But for the most part, facilities definitely try to identify someone that knows the client in the facility versus a volunteer. It's kind of like a last resort for other counties. I guess because Orange and Osceola and Seminole are a little bit larger, they utilize a volunteer program, but not a lot of counties have a GA program. We don't provide guardian advocates to children. Typically, children don't need guardian advocates because someone can be identified as a guardian, even if they may be in foster care. Someone from the state of Florida can represent them. So for
Right.
adults that need a guardian, they either need a guardian, like someone that's like kind of thinking about when you are under the age of 18, someone's your guardian. There are adults that need that. And then there's adults that need guardian advocates while they're in Baker Act receiving facilities. So for someone under the age of 18, they typically don't need a guardian advocate. It can help definitely the treatment team make a decision on the best person that can be a guardian advocate. There are some situations where there's family members that are available to be someone's guardian advocate, but maybe this is someone's second or third time being Baker Acted, and they had the same family member as a guardian advocate before, but unfortunately it didn't work out well, so they may not even recommend that person. They would maybe go towards a volunteer side. So it's kind of, if someone is able to confirm that they want someone to be their guardian advocate, they will look into that, but typically the treatment team will make the best decision for the client's treatment while they're in the facility. Yeah, so guardian advocates are volunteer surrogate decision makers for someone. So I have been using that word interchangeably, but essentially a guardian advocate is a volunteer. So everyone that completes our training and they assist with the guardian advocate request that the Mental Health Association receives, they're all volunteers. So just recently we were able to receive a grant that now provides us the ability to provide volunteers with a stipend. So before, maybe like maybe really a month or two ago, we weren't able to do that. So we know that this volunteer role isn't your typical volunteer role. So you're doing a lot of things, you're advocating on behalf of someone, you're researching. It's 3 to 5 hours per client, but there's different things that you could be doing. Definitely attending court. That can take up some of your time. So that's why we were able to definitely utilize the stipend to further assist the program. But essentially a guardian advocate is a volunteer. When I would say for liability, Based on the statute, the volunteers are essentially covered by the statute covers liability, anything that falls under that. And then we also have our in-house contracts that we ask volunteers to sign. So from what I've seen, I haven't seen any liability issues. If anything, we would just have to go case by case, but once a magistrate appoints someone as a guardian advocate, they are appointed by the court. So anything that falls under what they do would be backed up by the statute. Yeah, I think that's definitely a good question. For the most part, all of our volunteers, we definitely make sure we keep a lot of confidentiality for our volunteers. So when they are appointed to a facility, we just give name, contact number, and email address. They wouldn't have any other personal information. Clients are not able to directly contact their guardian advocate. The guardian advocate can always reach out to them at the facility and meet with them in person. Right, so if someone so for our guardian advocacy program, we provide guardian advocate volunteers. So if someone is involuntarily placed and the treatment team is requesting a guardian advocate and they can't identify a family member, friend, next of kin, close, somebody that knows the client well enough to be their advocate, or someone that's competent enough to be their advocate, then they can reach out to the Mental Health Association to request a guardian advocate. But each facility in the state of Florida, they do things very differently. It just so happens in 3 counties, there's 6 facilities that have a partnership with the Mental Health Association to provide a guardian advocate for that. So the court goes through a criteria for the guardian advocacy placement. So if someone meets that placement, so they're not competent to consent to treatment, so that basically means a doctor has spoken with them, they're asking them questions, and they're not able to get a clear response from them regarding treatment. And if they can sign off and consent to their own treatment, then they would petition for a guardian advocate to do so. Yeah, I was thinking maybe it might have been an availability situation, but if you've already established that you're available, that's interesting. I'm not sure. It kind of is up to the treatment team for why they would do that. And also the magistrate judge that makes the final decision on the petition for the guardian advocacy placement. So it might have just been to just have a backup person if you're not available. But again, I know you've already said that you told them that you were. So it might be a thing of where they just want to have 2 people accessible if they need it. Brevard and like Volusia, those counties, Polk, they do things very differently because it's a different circuit. So the 9th Circuit is Orange and Osceola County. They have typically the same magistrate judge that handles mental health court cases. Seminole has a different judge. So each circuit has a different magistrate that does things very differently. We want to go in the court hearing, definitely having best intentions that the magistrate, the attorneys, everyone is fully aware of what mental health is, what the Baker Act law is, how this process works. And that doesn't always happen, unfortunately. So everybody does things different. I've seen petitions get denied because of various reasons, and maybe that person really needed to receive that assistance, and petitions get approved, and maybe that person really could have gotten assistance outside of the facility. So it really just varies by county and the magistrate judge. There are some situations where maybe a family member was appointed as a guardian advocate and the facility wasn't able to reach them. Every time they just tried to discuss medication, it was a complete deny. I don't want to approve medication. They were appointed to make decisions regarding medication. Maybe they approved or just maybe denied everything. So sometimes it kind of just depends on how they work with the treatment team and if that person actually received that advocacy that they needed. Because in the training, we discuss making the best interest for the client and then seeking the best interest of the client. So finding out what they want. So maybe in some situations, people find out what they want and they go against what that person wants. Or they just make their own decisions regarding the person and they just handle it that way. Yes, they are. So guardian advocates only speak with the treatment team. They don't talk to a client's family at all. No, sometimes the treatment team will reach out to a guardian advocate to ask if they can contact a family member, so getting that approval. But no, yeah, they wouldn't. So I think that's a really good question because we do get that question from a lot of volunteers, just about making those decisions. Because when you're presented with a client that has a specific diagnosis, a psychiatrist and a treatment team are recommending a specific medication at this dosage, and they're just asking you to say yes or no. And you don't know what that medication is, you don't know the side effects, you don't know anything about it. So we definitely tell volunteers to reach out to us for assistance. So they definitely do that just to get that information about the medication. We always tell people you can always refer to the client's chart at the facility, look at their history. We also let people know after being appointed at a hearing to build some type of rapport with the client first. We definitely encourage that because facilities want to get the treatment started. They, I don't want to say they don't want to build that rapport process, but typically after a hearing, I've seen nurses, psychiatrists come into guardian advocates, put consents in their face and just say, here, sign. Don't look anything type of thing. So that's not what we encourage. We want everyone to have that moment with the client. Yes, the treatment team will be calling, asking you to approve medication or not approve or asking you what's going on. So we want to have that time to get to know someone, understand their story, understand what they're going through, and then make the best interest for the client. So there are some guardian advocates that definitely make stern decisions, what's necessary. If someone has an allergy to a medication and the facility is not recommending Benadryl with that medication, or they're not recommending anything, they're going to look into it. They're going to ask more questions. They're not going to just say, yeah, I provide consent. Because we also have, when we go into the training, we talk about our documentation. So our visitation forms that document everything that a guardian advocate does, and they have to submit those. So that's required. So they're documenting what they're approving as far as medication. Every communication that they have with a client, they should be writing it down and documenting that at all times. So I definitely can see how that can be a concern, but definitely we encourage volunteers to reach out to me, reach out to others at the facility. If you have a question about medication, if you have a question about specific treatment, I know a lot of our volunteers have questions about ECT, electroconvulsive therapy. So they don't want to just say, yeah, okay, I agree to this treatment happening. No, we want them to get more knowledgeable about it, ask questions, and then we'll assist them as best as we can. Yes. Yeah, I think that's a good point to mention. So even if a guardian advocate does approve a medication and they are trying to give it to a client, the client can still deny it. I know we have clients right now that they have guardian advocates and they refuse to take the medication. So unless prior to a guardian advocate being appointed, there is emergency treatment orders that can be administered. So that's basically forced medication, which is usually an injection. But after a guardian advocate is appointed, they no longer can submit ETOs. So typically they have to get still some type of approval from the client as well. So if they're refusing, it's kind of like, what can we really do? Yeah, it kind of just depends on the facility and the treatment team, but I definitely have heard people getting calls at least once a day or every other day. I know some facilities will ask you what's the best time to reach out to you, but if they need something approved right then and there, they're gonna reach out and try to contact you. As long as it's in the client's chart when they're at the facility. So if they need to request documents, they'll ask the guardian advocate to sign off on that consent to get any records that they may need. But everything typically is usually in a client's chart. If they've been at that facility before, if they need to access something else, then again, they'll ask you for that release to get that information. Did you complete it with the Mental Health Association? Yeah, it doesn't expire. So you can just email me. For the most part, I would say, because I think we've had a couple of guardian advocates that were trained like in 2005. I think 2005 through now, we definitely have some type of record of it. Like I've seen it. They did a really good job of scanning all those sign-in sheets and post-tests. So I should have that information as long as it was like from at least 2005. Yeah. You definitely can, and once appointed, you can remove yourself from the case. It depends on the facility. So we have a partnership with 6, mainly in Orange County. So also volunteers, they can pick a preference for whichever location they want to go to. But sometimes we have a partnership with University of Behavioral Health. But we get like 1 or 2 every other 3 months from them. But Aspire Health Partners and Advent Health, we get requests from them on a daily basis. So it kind of just depends on where you want to go.